Hi everyone, my name is Mariam and I'm going to do a short video today that is aimed for postnatal and antenatal ladies. This is completely safe to do so, but the main thing is to make sure you always listen to your body. So if you've not been exercising in your pregnancy or after, then please make sure if you need to ask for some advice from your midwife or your doctor, then make sure you get that first. And if there's anything that you need to modify, then please make sure you do so. Everything is safe to do so, but if you need to stop, make sure you do. Please make sure there's some water available for yourself if you need to stop to take a sip of water. And if you don't feel well, and if something doesn't feel right throughout the exercises, then please make sure you stop. And just be aware of how your body is feeling today. Okay, so we're going to start by making sure everything around you is nice and clear. So make sure you're in a suitable position and clothing wise as well, something that you're comfortable with. You don't need a mat, you can just do it on the floor or a carpet, wherever is comfortable for yourself. So we're going to start with just having our legs crossed. I've just got my legs crossed. You can have your legs open if you wish. And we're just going to start with thinking about the breathing. So I want you to place one hand onto your chest and one onto your abdomen. So this is, if you are pregnant, then obviously a lovely way to think about bonding with baby as well. So we're going to take a nice deep breath in through the nose and then deep breath out through the mouth. Inhale and exhale. So I just want you to concentrate on the breath. We're just going to take the first few minutes just to really think about becoming connected with your breath and what that breath is doing. You want to take the breath in through the nose, expanding the rib cage into the lungs, and then as you exhale, you want to empty the lungs. I want you to think about feeling that navel back towards the spine. So if you've got baby there, I want you to just think about pretending that you've got this big belt around your waist. And we're just going to tighten the navel back towards the spine and think about engaging your core. So nice deep breath in, feel that rib cage move, and then exhale, empty the lungs, feel the tightening in the core. And I just want you to stay here for another couple of minutes. So everybody is different. Your breathing will be a little bit different, so you might be breathing a little bit faster or slower, whichever. I just want you to concentrate on yourself and just focus on what that breath is doing, where it's going and what's happening with the abdomen. You can feel that tightening in the core, feel that lift in the pelvic floor as well. So think about warming up the core, tightening the navel back, lifting the pelvic floor, connecting with the breath. Good, just a couple more. Relax the shoulders, deep breath in and out. Good, well done. Okay, and then we're just going to slowly bring our hands forward onto our knees. And we're going to start to make a small C shape with the spine. So depending on how you are, how you're feeling, if you are pregnant, then just think about just opening up the upper back. And then slowly relax and push back, forward and back. So you want to feel the shoulder blades lead here. Slide them out, so imagine them just pulling out to the side, and then as you lift, I want you to imagine your shoulder blades are just lifting back together. So inhale and exhale, nice deep breath in and out, work with your breath. If you're postnatal, I want you to think about squeezing that pelvic floor as well, and again you've got that belt around the tummy, and if you can push a little bit further back, then that's brilliant. Just see how you feel today. So in your pregnancy you might have a bit of tightening in the lower back, and postnatal, that can be affected after as well. So think about just opening up that spine, nice and easy, just easing off, rolling forward and back. So again, take your time, don't rush the movement, and just see if you're still connecting the core with the breath, still got that tummy nice and tight, still got that lift in the pelvic floor. Good, shoulders are back and down, got that lift in the head, and you're just lifting up that collarbone at the top as well, so not neglecting at the top. Brilliant, we're going to do one more. Breathing in and breathing out, and then just hold it here. Fantastic. I just want you to relax the legs back, so just let your knees collapse, and then all we're going to do is think about the neck here. So when you're ready, we're just going to slowly slide the head to the side, let the arm relax by your side, and we're just going to open up across the back of the neck there. Nice deep breath in and out. So just give yourself a couple of breaths here, just opening up the neck. When you've done your two, relax the hand down, and then we're going to change sides. So nice and easy, just take the tension off the neck, take the tension off the shoulders. So this should feel very nice Should feel very relaxing, opening up the side of the neck and the back, into the upper back as well if you can. Good. 2 breaths there, and then release. Drop the chin down towards the chest. Relax the shoulders back and down. So we've still got a lift in the chest. We're still thinking about the abdomen, so keep that tightening in the core. And you've got the lift in the pelvic floor. I just want you to hold it here. Just open up the back of the neck. Just giving the vertebrae a little chance to just warm up. And then slowly begin to roll the head up. Bring it in to head level. I'm going to hold it here. Fantastic. And then just nice and easy, we're going to take it over onto our fours. So we're going to be on our hands and knees. I'm just going to make sure you can see me. So our hands are underneath the shoulders and knees are underneath the hips. So we're just going to think about now bringing in the mid of the back. So the middle back and that lower back. And just thinking about opening up. So if you are pregnant, don't worry too much about the dip. See how you feel. So if you need to stay here and just focus on the upper back, then that's absolutely fine. If you're antenatal, if you're postnatal, then if you can, just work with what feels right for you. If you can add that more dip in that lower back, in the mid, whatever feels right for you. So nice, easy breath in and out. So inhaling, exhaling. You can lift the chin if you wish. You can keep it up parallel towards the floor if you feel that's better for you. Nice and easy. Just think about mobilizing and opening up the spine. Good. Give me one more. And then we're just going to hold it here in center. Tummies are nice and tight. You've got that belt around the waist. Your shoulders are back and down. We're just going to relax the arms as well. So you're not locking the arms out through. Just a slight softening of the elbows. And then we're going to just take our right leg out. So I want you to just push the heel back, and all we're doing is just going to push the heel back towards the wall and then forward. We're just opening up, just warming up the calf. So forward and back, forward and back. So you should be able to feel a little bit of tension across the wrist here. That's fine. So if it's uncomfortable, if it's too much, then just stay here with the leg pushing forward and back. Otherwise, we're thinking about warming up those calves, warming up the wrists, getting a little bit of work across the forearms. Good. Give me one more, and then take it down, and then change sides. Opposite leg goes out, slide the heel back, and just push the heel away, and then forward again. So back and forward, back and forward. Good. Keep that back nice and long. Want to keep that brace in the core. So imagine that belt around the tummy. Shoulders are back. Softening on the elbows, push the heel away and then push through. Heel back. You should be able to feel that work across the calf there. Good. Last one. And then bring it back to center. Hold it here. Now I want you to make a little bit of gap. If you need to take your legs a little bit wider, if you are pregnant, then have a little bit of gap there between the legs for baby, and we're just going to slowly take it into your child pose. So the head is resting down. If that's not possible for you, you can make a block with your hands and just rest the head down and just push the hips back nice and gentle, opening up across the hips and lower back. Just take some nice deep breath in there for me. Inhale and exhale. And think about relaxing the shoulders. Deep breath in, deep breath out. Good. Just give yourself a couple of seconds here. A couple of breaths just to open up the hips. Breathing in and out. Tension in the core, so keep that tummy tight, and you want to keep that lift in the pelvic floor. You have one more here. Good. Nice deep breath in, nice deep breath out. On the last exhale, we're going to take the hands forward. And I just want you to walk them forward just a teeny bit more, so you get that little extension across the shoulders, and bring yourself back into your box position. So knees underneath the hips. Now here, we're going to curl both toes under. And again, you've taken your hands forward, and we're just going to gently push the hips back. Now if that's too much for you, you can stay here with your knees soft, or you can stay into your child pose position, whichever feels right. You have 3 options: child pose, knees soft, or if you feel okay to do so, we're going to take it into your down dog. So drive the heels down and keep that nice lengthening across the legs, and let's take some deep breath here. So we're just going to stay here for 2 breaths. Nice inhale
Nice exhale. So think about why you're here. Drive the heels down if they'll let you. If not, you can keep your heels off the floor. You can keep the knees soft. Just feel that tension across the thighs. And I want you to activate your quads. So squeeze your thighs and drive the hips back. Keep that lengthening across the legs. Breathe in and breathe out. Tightening the tummy. Keeping that nice tightening in the core. Well done. One more breath here. And then on your next exhale, we're going to soften the knees, bring yourself down, and then we're going to take your right leg forward. Now the right leg is going to come wherever feels right for you. So we're going to just take the leg forward, hands by the foot, opposite leg behind, and you can stay here if you wish, or we're going to take it up into your lunge position. Now I want to keep that tailbone down, dropping, keeping that lift in the chest, keeping the abdomen tight, shoulders are backing down, and we're going to take a few breaths here. So we want to think about opening up the hip flexors. Our hip flexors gets really tight across our pregnancy and afterwards, so we're just thinking about opening up there. So just take a nice deep breath in and deep breath out. Inhale and exhale. Now keeping that core tight, so you've got that belt again, your shoulders are soft and relaxed, the lift in the chest, and we're just breathing through. So again, connecting with the core, squeezing the pelvic floor, nice deep breath in and out. So you're going to do about 3 breaths here. When you've done your 3, we're going to take the hands down. We're going to take the opposite leg behind. So the leg behind is back on 2 toes, and we're going to just slowly lift the leg up. Now you can stay down if you wish. Otherwise, we're going to lift that leg and we're just going to drive the heel back. I want you to keep that lift in the chest, so you want to keep the opening. Now, if you wish, you can come up onto your wrist if you need to, or your fingertips, whatever feels right, or like I said, you can stay down. Hold it here. Let's breathe for 3. Inhale. This is a great stretch, great opening up of the hips, but also to work on the strength across the legs as well. Raise the core, squeeze the pelvic floor, shoulders relaxed. 3 breaths here. When you've done your 3, nice deep breath in, take the leg down, and then swing the leg back, or however you feel right, and then press back into your child pose and take a short recovery. Well done. Once you've done your breath here, we're going to go to the opposite leg. So again, deep breath in. As you exhale, nice and easy, take that opposite leg coming forward into your lunge. Back leg relaxed, hands forward, chest is lifted, so opening up across the chest. And then again, drop your tailbone down, tighten the abdomen, lift that chest, and let's breathe. So you can keep your hands on your hips, on your leg, or if you feel okay to do so, we're going to lengthen the arms over and above your head. So keeping that spine long, bracing the core. Keep the hips facing forward and feel that nice opening across the hip flexors there. Open up across the hips. So let's breathe for 3. Inhale. Exhale. Inhale. Deep breath in through the nose. Thinking about what's happening with the pelvic floor. Thinking about tightening the core back towards the navel, back towards the spine. Keeping baby close to you if you're still pregnant. Breathe. And when you've done your 3, just gently take the hands down. Nice deep breath in and out. And again, you can stay here, or option 2, curl the back leg, and then when you're ready, lift the leg off the floor, push the heel back, and let's hold it here. We have 3 breaths here, so back nice and long. I want you to squeeze your glutes, engage your core, and squeeze the pelvic floor. Let's breathe here for 3. Inhale. Exhale, deep breath out through the mouth. Relax the shoulders. Inhale. Exhale, good, nice and control with the breath. Think about what's happening in the mid. Feel that work across the thighs. Brilliant. When you've done your 3, soften the knee, take it down, swing the opposite leg behind, back into your child pose, and take a short recovery here. Inhale and exhale. Breathing in and breathing out. Good. Just relax the shoulders. Yourself a second here. Remember to make sure you've got that gap between the legs. If you need to open up, if you're pregnant to make room for baby, then make sure you do. Once you've done your 2 breaths, walk your fingers forward, legs apart, curl your toes under, brace the core, and then back into your down dog. So push the hips back, lengthen, drive the heels down if you can, or if they need to stay up, that's absolutely fine. There's a bit of tightening across the backs of your legs and your hamstrings. Just hold it there. Just give yourself a second, breathing in and out, and see what's happening with the core. So engage the tummy, squeeze the pelvic floor, squeeze the thighs. So just really think about squeezing those quads. Good. When you've done a couple of breaths here, we're going to soften, bring back, child pose, take a short recovery. Well done. Inhale and exhale. Just relax the shoulders. And then when you're ready, when you've done your 2 breaths, you're going to take it back up. So this time, nice and gentle, we're just going to slowly shift ourselves over onto our side. So we're going to take it into a mermaid pose, so a side pose here. So take your hand down, so the same side, opposite legs coming over to one side, and I want you to reach up and then extend. We're thinking about a lateral flexion here, opening up the side, so it should feel nice and opening across the side of the waist there. So lift the head up, soften the shoulders, keep that lift in the chest, brace your core. Again, you've got that belt on, and we're just going to hold it here. Breathe in and breathe out. Again, inhale and exhale, and then just slowly relax. Take it back to center, breathe in. As you exhale, lift up and then over and stretch. Now it's up to you. You can stay halfway if you feel that's right for you, or if you can, then obviously extending a little bit further, you should be able to feel that nice lateral stretch across the side. Breathe for 2, breathing in and out. Inhale and exhale. Good. 2 breaths. We've got 1 more to do on this side. Deep breath in, reach it up and over. Let's breathe. Inhale, exhale. So it should feel really nice, especially if you are pregnant and you've been quite tight at the top here, to really open up the lengthen through. So remember not to overstretch when you're pregnant. We're just having a nice stretch here. You're not pulling through. Good. 2 breaths and then relax. Well done. We're going to take both legs forward, and you're going to take your legs in line with your hips, or if you wish to take your legs a little bit wider, then take them out to the side. So your toes are flexed up towards the ceiling. We're going to place our hands onto the thighs. We're going to take a deep breath in, and all I want you to do is just try and lift up from the hips, from the lower back, and you're going to just slowly begin to reach forward. Now keep your toes flexed up towards the ceiling if you can, and just begin to slowly reach forward, lengthening the backs of your legs, keeping them as straight as you possibly can. And let's just breathe here. So inhale and exhale. You've got that nice tightening in the abdomen. So baby's close to you if you're pregnant. If it's postnatal, I want you to imagine you've got that belt around the waist, and squeeze the pelvic floor, and then slowly begin to lengthen and drive back. And again, breathe in, lift up from the hips, up from that lower back, and get that nice stretch there. Breathe in and out. You can relax the head if you wish, get that nice stretch at the back, or you can keep your head up, entirely up to yourself. Good. 2 breaths here before you reset, and breathe in again and breathe out. Lift and press forward, stretch and open up here. 2 breaths. Inhale and exhale. Inhale and exhale. Good. When you've done your 2, nice and easy, begin to roll back, and we're just going to slowly take the legs over to the opposite side into our second mermaid stretch. So the opposite legs come behind now, hands coming forward. We're going to reach up towards the ceiling and then lengthen through. Breathing in and breathing out. Breathing in and out. Take the hands back. Good. We've got 2 more. Inhale, reach up and then over. 2 breaths here. Inhale, exhale, inhale and exhale. Good. And relax 1 more time. Reach it up, breathe in, exhale, relax, lengthen through, get that nice stretch across the side. 2 nice deep breaths in. You've still got your core there, you're still engaging that belt back and down, squeezing the pelvic floor for 2 breaths.
And then exhale and back to center. Well done. Take your legs cross for me. And then we're just going to take some nice deep breath in and out to finish. So breathing in through the nose and out to the mouth. So we're going to finish as we started. So place your hands onto your chest and one onto the abdomen or on baby. Let's close our eyes and just take a couple of breaths here. So just want you to finish up with a couple of breaths in and out. Let the heart rate drop. Just slow that breath down. Well done. And just think about how well you've done. Turning up and just giving yourself 15-20 minutes. Just a little bit of movement through the body, helping you mentally and physically. Nice deep breath in and deep breath